Saskatchewan is facing a massive backlog of surgeries due to the COVID-19 pandemic. Many provinces are, but in Saskatchewan, they are looking to the private sector for a solution. 35,000 surgeries have been postponed in Saskatchewan. The government is looking at privatizing some procedures paid for with public funds. So how will all of this work? Paul Merriman is the Minister of Health in Saskatchewan, and he is in Saskatoon. Minister Merriman, very good to have you on the program. Look, I want to begin. I look at the number 35,000, and this number happened because healthcare facilities were needed for caring and preparing for COVID patients. Do you think that if your government had taken different steps, that you wouldn't have a list that long, that you wouldn't have had the explosion of cases that necessitated redirecting healthcare resources?
Well, we did have to redirect our healthcare resources from our acute care into our ICUs, which obviously took some people, some very skilled positions out of the emergency rooms and out of the operating rooms to be able to backfill, which was mostly unvaccinated people that were coming into our healthcare system. The 35,000 that we do have that are postponed surgeries are going to be done through the public sector, but also through the private sector that are publicly funded. So we're going to maximize within our Saskatchewan Health Authority, but we're also going to complement that with private surgeries that are publicly funded to be able to address that backlog. So we're going to have all hands on deck.
How does using the private sector to do this change the capacity? Because as I understand it, you're going to still be using ORs, operating rooms that are in hospitals you have, and it's not like there's surplus operating room nurses, for instance, running around the province. You still have to pull them out of the public system. So how does getting the private sector involved here expedite getting through these surgeries and other procedures?
Well, a lot of the surgeries that we have, about 65%, are day surgeries. So those are on an outpatient basis that we can do off the grounds of the hospital. We do have private surgical facilities set up outside the hospital system, but are using the same resources within the hospital. So these are the same doctors and nurses and specialists that are inside our hospital system. But outside the system, we can create some efficiencies through the private sector to be able to make sure that we can get more people through, but also provide that same quality of care that they have expected in the Saskatchewan hospitals. So there are some efficiencies that have been proven over the last 10 years that we've been doing this. We've done 120,000 private surgeries that have been publicly funded, and they've worked very well. So we're looking at expanding that, but also looking at expanding our public system operating hours, whether we can use them in smaller communities, and also making sure that within our major centers that we're being as efficient as possible.
How long will it take to get through 35,000 procedures?
Well, we're planning that it's going to take about 3 years. We're going to do an additional 7,000 next year and next fiscal year. And then we're going to add on 6,000 to that. So it'll be 13,000 in year 2 and then 18,000 more surgeries in year 3. But we're also expanding our ICU capacity within our Saskatchewan Health Authority so we can have more patients be able to recover quicker. And we're also looking at both the bookend from the diagnostic to the recovery to any therapies that might happen. We were looking at the whole spectrum of healthcare services to make sure that we can get people that have been diagnosed with a surgical need back to recovery and back to their normal life as soon as we possibly can.
So the backlog, it would take about 3 years to clear. And when it is clear, is it your expectation that you will no longer need the private sector to do as many procedures? Or do you see this as something that will become a more permanent feature of Saskatchewan's healthcare system?
I think it'll become a permanent feature. It's worked very well over the last 10 years. We'll continue to utilize the private sector that is publicly funded. The costs have come in under what is done within our Saskatchewan Health Authority. And we're very proud that we're able to do this. We're able to work with the private sector, the same doctors, same nurses, same technicians, just creating some efficiencies within our healthcare. And that private allows us to be able to do more surgeries that are complex, that require a multiple overnight stay in our hospital systems where they should be done. But we're also looking at other areas that the private can complement our publicly run system to be able to help us out, because we do need to have all hands on deck, and we want to make sure that we're addressing this because the people of Saskatchewan have been very patient in waiting to get their procedures done, and we want to be able to get that done for them as soon as possible.
Yeah, and I imagine for those people who have been waiting for procedures, it will come as a welcome relief to have at least some timeline attached to that. But if I can for a moment, I'll go back to where we started this interview at. Your government faced some criticism over the way in which it dealt with some of the waves of this pandemic, not introducing restrictions at a time that many doctors in your province were calling for restrictions, at a time when there were significant numbers of cases. And the consequence of that was that many in the healthcare system had to be redirected to care for a growing number of patients, including in the ICU, and that resulted in the delay or postponement of many procedures that are now in this backlog. Do you regret that you didn't do more before to avoid the list getting as long as it is now?
Both the Premier and I have said publicly that looking back, we wish we had done this a week to 10 days early. But when we did do our restrictions and our guidelines from Dr. Shahab, our Chief Medical Health Officer, in Saskatchewan, we were able to do 260,000 new shots in the last 2.5 months, which is a very significant amount. We were able to get about 20% of our population in first and second dose. Right now, we're leading our country in pediatric vaccinations from 5 to 11. So yeah, we do have a backlog, but we see that the fourth wave is certainly moving across the country right now, and this is going to create some challenges in some other healthcare systems. So we had our fourth wave in September, October, and into November. We're very happy with the results of getting more people vaccinated, and that was the push to be able to do that. The restrictions that we had in place, but also the people of Saskatchewan started to understand, as well as everybody else in the country, the importance of getting vaccinated.
Minister Merriman, thank you very much for your time tonight, and good to see you. When I was a younger journalist, I covered your dad in politics, so neat to see you. Thanks a lot.
Thanks very much, David. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.